Good morning. First of all, I'm very pleased that both of you, Representative Cantor and Representative Scott, have agreed to do this, and that Tom Silvestri had the wisdom to put this together. I think it really is much, much better than a town hall meeting, so thank you for that. For me, this gets personal. I am Patricia Churchill. For me, this gets personal. I have a very close relative, a woman in her early 40s who did have a wonderful, high-paying job, owns her own home, and was a real contributing member of society. She lost her job. Just a couple of weeks ago, she found out that she has tumors in her belly and that she needs an operation. Her doctors told her that they are growing and that she needs to get this operation quickly. She has no insurance. I'm just wondering, gentlemen, we can talk about half-blown ideas and we can talk theory all we want to, but this person is a very close member of my family. She's ill and she has no way to have this operation. So I'm asking you, what would you do if this were your close relative, your niece, your aunt, your sister, or whatever, and she was in this situation now? What would your solution be, and how would you be involved in helping her?
Well, the plan that we have will provide universal coverage without a prohibition against pre-existing conditions. She would be able to get insurance. She would not only already have insurance. If she lost her job, she would buy insurance. She would not have employer-based coverage. She would buy it through the exchange. You would have the private companies selling insurance, and you would have the public option as a low-cost, competitive choice. The question has been, how can the government afford it? The government is not subsidizing the public option. The public option will be paid for with premiums, and as costs go up, the premium is going to have to go up, so that the plan is self-sustainable. Some people mentioned Medicare Advantage. Medicare Advantage gets a subsidy through the government. When they started this thing, the private company said they wanted to get in and provide the service, and if they could just get 95% of what the fee-for-service cost was, they'd be able to make money because they felt they could run it more efficiently. 95%. Now they're getting about 114%. Not 95%, not 100%, 114%. What our proposal is to drop them down to 100%, 5% more than they asked for when they got into the business, and that 14% will help pay for the costs of the universal coverage. We believe that the companies will continue to provide it because that's what they said they would be able to do at 95%. They'd be able to do it at 100%. So that so with your relative, we have a plan that will provide universal coverage so that she would be covered with health insurance. We need a situation where everybody will have insurance, and she would have had it, and if she couldn't afford it, there are affordability credits or Medicaid for her in that situation.
Let me try and address it again, get away from the high-flying theory, because I know that's a real problem, and it must be just overwhelming you and the family. First of all, I guess I would ask what the situation is in terms of income eligibility and the existing programs that are out there. Because if we look at the uninsured right now, there is probably 23-24% of the uninsured that is already eligible for an existing government program. That frankly, the government has not done an adequate job at going out and making people aware and signing them up. So that would be, I guess, my first question, if I was in the instance that you're in or the family's in, as to what to do. Beyond that, I know that there are programs, there are charitable organizations, there are hospitals here who do provide charity care, that if there's an instance of indigency and the individual is not eligible for existing programs, that there can be some cooperative effort. No one in this country, given who we are, should ever be sitting without an option to go be addressed in terms of health care. And that's really That's really what I'm here to tell you. There are resources available. We have a very imperfect system, which is why Bobby and I are both here saying that the current system is unsustainable. It's unsustainable, yes, because of cost, but yes, because of the human aspects of what happens, because of this. That's why we've got to bring down costs. That's why we've got to be very serious on the education effort as to how to allow for there to be more options to cover different situations. And my fear, again, and get back to the theory, is when you go and impose this theoretical government program as being the true model for what an acceptable benefit plan is, that program operates under completely different rules. It doesn't operate under the rules that most Americans get their health care with today.
Thank you for your question. Appreciate that. Welcome, man. About 25 minutes left. Public square.